Good afternoon, everyone. My name is Jan Christensen Wood, and I am the President of the Canadian Association of Social Workers. I'm pleased to welcome you to today's presentation on a federal perspective of social work and medical assistance in dying. This presentation is one of a number offered throughout March in recognition of National Social Work Week, and Social Work Month. Our presenter today is Sally Guy, CASW Director of Policy and Strategy, who led CASW's efforts to successfully influence Bill C-14, the legislation that effectively legalized MAiD, M-A-I-D. Before we get started, some housekeeping items. Sally will be presenting for about 40 minutes, followed by your questions and her answers that I will moderate. As a note on privacy, only the presentations team can see your name and question, so please feel free to type those in throughout the presentation. In addition, we won't be identifying the person who has submitted the question. As a reminder, the recording and the PowerPoint will also be up on CASW's website after the presentation. With that said, it's my pleasure to welcome Sally.
Hi, everyone, and thanks so much to Jan for that introduction and everyone who's taking the time today to tune in with us. So before I really dived into the meat of this, I did want to give a quick overview of what we're covering today. So if you're an expert in the field and you're wanting to learn more about best practices, this likely is not the webinar for you. I also do need to say at the outset that the presentation shouldn't be construed as a substitute for legal advice or for advice from your regulatory body. What this webinar will be great for is giving some insight into CSW's policy process, kind of using MAiD as a case study, provide an overview of the provincial status, and I hope most of all that it's going to alleviate some anxieties for those of you who may not work in a hospital or healthcare setting, but who are worried that this could come up in the future with a client. I'm also going to address some of the most frequent questions that we get and address some pervasive myths as well. So before I get into how CSW influenced this legislation and why we chose to go about it in the way that we did, I will just give a brief refresher of CSW's role and sort of how we're situated in that landscape. So when MAiD became a reality, we got lots of calls that revealed a few misconceptions about us. So this graph right here, this graphic, is showing you the three pillars or the sectors, if you will, of our profession. So we had a lot of calls asking us, are you going to make sure that each school of social work addresses this in your curriculum? And so the answer to that would be no, that the educators, so the Canadian Association for Social Work Education, represented on the left there, CASWE, it's up to them to approve the standards of accreditation for schools across Canada. The other question we got a lot of was, are you going to be setting the practice standards? Are you going to be dealing with the complaints from the public on this when it comes up? And again, no, we do not have a regulatory purview here at CSW. The regulatory bodies are represented by the Canadian Council of Social Work Regulators, who are on the right-hand side there, and they're the ones that are taking care of those kinds of issues. So with that refreshed, how does CSW set its policy agenda? How do we decide what to comment on and why? So we actually operate by consensus, which we are incredibly proud of. That means that any policy position that comes out of our offices has been approved by consensus by our board, who you see here, and they come from all different social work backgrounds. One is appointed from each of the provincial and territorial partner organizations. And because of this model, we do have tremendous power when we present our advocacy efforts and our asks to government and other stakeholders. Because we can say that, next slide, all of these voices and all of the voices they in turn represent are included in that policy recommendation. So this picture, by the way, is the executive directors, board members, presidents from each of those partner organizations. So, the Alberta College of Social Workers, the New Brunswick Association of Social Workers, Manitoba College, etc. That's who you're seeing there. So with that covered, what did the timeline look like for this issue? How did we get to where we are today? So one of the first times that this really confronted CASW and the public as well was probably back in the early 90s, around the time of the Sue Rodriguez case. And Rodriguez, of course, had ALS and famously fought to have the criminal code amended to allow for assisted suicide, but lost in court in 1993. So in 1993, CASW put out a statement of principles on assisted suicide, and it really reiterated the importance of self-determination, the client's expertise in their own life, and essentially advocated for the fact that clients should be at the center of their own care, all the while not taking an explicit policy position. Then a long time passed. It really wasn't until 2013, 2014 that the issue took public stage again in that way, when Quebec introduced Projet de loi 52, which ended up eventually legalizing certain forms of medical aid in dying in that province. Then, of course, fever pitch in February 2015. That was when Canada saw that landmark Supreme Court ruling that did bring about the effective legalization of MAiD. And the most interesting thing maybe is that they gave the government just about a year to shape that new legislation, so to decide what that policy would actually look like on the ground in Canada. So right away, the first thing we did is we re-released that 1993 statement with some updated language to reflect current use. And that was really to say, our voices matter, social work voices matter, and we will not be forgotten. And then we reflected. And during that time, there were lots of internal and external pressures. So, of course, our board and the public wanted action on the issue. We were getting lots of calls from social workers, lawyers, everyone really, asking what this meant for our profession and for practice. But we knew that we had to get to consensus before we were going to take any meaningful policy direction. So why is it that, getting to consensus can be tough generally, and why is it so tough on this particular issue? And I think our president at the time, so the president before Jan, he put it very well, and he said that it's because it exists at the intersection of the right to self-determination, and of course our huge respect as social workers for that value, and also the importance of protecting and upholding the rights of society's most vulnerable. This slide, I included this from when I've done this presentation to a live audience, because I know that this recording is going to be available afterwards, so you can pause and skip to the places you want to get to, so it could be a good resource for later. And the other thing is that some of you are watching in groups right now, and you can participate right now if you like. So to provide a bit of context for this activity, during that year period, when the government was developing that legislation, they were holding consultations, they were looking for input, and they were just really trying to get their bearings because it could have taken any shape. So here at CSW, and I think everywhere in the social work community, people were really grappling with these huge gray issues. So during this specific activity, I had everyone come up with one reason for and one reason against each of the elements I'm about to introduce from a social work perspective. So first up, medical aid in dying in the first place. Now that it's legal, I think it can be easy to overlook the fact that that in itself is an incredibly controversial topic that is so loaded for so many people. Mature minors. So, from a social work perspective, should a 16-year-old suffering intolerably not have access because they aren't 18? Advanced directives. What in theory would the Code of Ethics say or the profession of social work say about giving people the opportunity to choose MAiD before they lose the capacity to consent, say, due to Alzheimer's? What about non-life limiting illnesses? Should people with non-life ending illnesses have access to this as well? And, lastly, mental illnesses. Should people suffering from mental illnesses with no other physical illness have access to medical assistance in dying? So I think that what's immediately obvious, or what I hope is immediately obvious, is that we could be here all day discussing these controversial issues. And I hope that it illustrates, thinking through this, why it can be so difficult to come to consensus on what, the Canadian social work perspective on policy issues like these should be or whether we even should take a stance. It's certainly one thing to figure out your own perspective on some of these things. It's another to come to consensus without letting those personal biases impact you on a stance that should take into account, the huge variety and diversity of social workers in Canada. But what we did know, however, was that there was one question that every social worker could answer an absolutely huge yes to. And that was, yes, social workers absolutely have something to contribute, and that we absolutely needed to be included now that it was a legal reality. So armed with that, we focused on what we're good at, which is supporting self-determination, advocating for equity, and the dignity and respect of all people. We also knew this conversation could not take place in a vacuum outside of discussions about the rest of end-of-life care, and we were not going to let the importance of palliative care get lost in the discussion either. So in April 2016, we released a paper that made recommendations to the government, and it said, to summarize, 1, the time is now for the federal government to develop pan-Canadian standards for both palliative care and PAD. And you'll notice here that we were using the old language of physician-assisted dying, which has since changed to reflect the fact that other health professions are now involved, but at the time it was PAD. 2, a palliative-first approach to care, including the development of a more robust and accessible model of palliative care, is crucial in ensuring that Canadians do not pursue PAD due to a lack of adequate or accessible palliative services. And 3, vigorous safeguards must be put in place to protect persons vulnerable due to any factor and to ensure that no Canadian pursues PAD due to coercive influence. Or jump to slide. So 4, the Criminal Code of Canada, this one was the big one for our profession. The Criminal Code of Canada must be amended to provide explicit legal protection to social workers. 5, social workers are going to be requiring training and support specific to this. And 6, social workers, their unique perspective and expertise should be integral members of teams that are caring for Canadians considering this. So the next thing we had to do was to whittle those recommendations down into a submission to government. And we were asked to witness at the Standing Committee on Justice and Human Rights, which was the committee asking for amendments to help shape the final version of the legislation. So the first version didn't include social workers, and our profession, I think, was more worried than ever at that point. And so at committee, I politely demanded that social workers be explicitly protected in the criminal code and stressed the incredible importance of both safeguards and palliative care. And at that point, it was a waiting game until the legislation was finalized. And we ended up getting some huge results. So the legislation came out and it, first of all, contained this. The Government of Canada recognizes that in the living conditions of Canadians, there are diverse circumstances and that different groups have unique needs. It commits to working with provinces, territories, and civil society to facilitate access to palliative and end-of-life care and services for individuals living with Alzheimer's and dementia, appropriate mental health supports and services, and culturally and spiritually appropriate end-of-life care for Indigenous patients. So we were so happy to see that. It really highlighted the equity and individualized care messages that we bring, and also serves as something that we can use to bring back to government to say, listen, this was put in writing, and you're not living up to it. The other huge win is that we were successful in having social workers included for explicit protection written into the criminal code. So it was amended to say, for greater certainty, no social worker commits an offense if they provide information to a person on the lawful provision of medical assistance in dying. And then you'll see underneath that, too, is the other amendment that applies more broadly, but is good for clarity for us as well, too. So now that it is legal, what does it look like? Who has access? Broadly speaking, to access MAiD, a client or patient or service user must be at least 18 years of age and capable of making healthcare decisions. They have to have a grievous and irremediable medical condition, and their death must be reasonably foreseeable. They have to have made a voluntary request for MAiD that was not the result of external pressure, and they have to be able to give informed consent. And as a caveat, the persons or people that are going to be determining informed consent, whether that's capable of being given, are only doctors and in some provinces nurse practitioners, so that won't be a social work role, strictly speaking. So what does this mean for your practice in a broad sense? One of the things that I think caused a lot of anxiety for people, we had a lot of people calling in about this, was that they were feeling anxious that the criminal code still says, and it still says to this day, that it's illegal to counsel someone to die by suicide. And because of the double meaning of the word counsel, I can see where some of that anxiety comes from. But in the criminal code, it really does mean that you must be persuading or encouraging someone to die by suicide. So having open, honest conversations about MAiD is certainly perfectly legal. The other thing is that the criminal code created a new legal choice called medical assistance in dying that is understood as a separate entity from suicide. The other thing that we get lots of questions about is, of course, the ability to decline, so the ability to conscientiously object. So, of course, the legislation is permissive. It means it doesn't force you to do anything. If you're not comfortable being involved in MAiD or in discussions about MAiD, you can certainly decline to participate. I am going to clarify this a bit further later because it does need a few caveats. But the other thing people ask a lot about is protecting yourself. So how do I protect myself as a clinician and make sure my bases are covered? What I have up here is a quote from the underwriter to our insurance provider, BMS Group. And I would just say, too, if you don't have professional liability insurance, no matter what field you're in, I would encourage you to look into our program and to check with your employer to see whether you would be covered by them in the event of a complaint, because many people aren't, and then that surprises them. Anyway, they confirmed that if you are practicing within the scope of practice and there is a complaint against you relating to, say, providing information on MAiD or assisting a doctor or nurse practitioner on your team, on your care team with MAiD, that your insurance policy would respond to protect you. I also want to add in here, too, just verbally, because I got a question about this morning, actually, is that you'll notice that the bulk of guidance and information on MAiD out there is actually specific to cases where the lethal substance is administered by a doctor or a nurse practitioner, so that being voluntary euthanasia. So they're there administering that drug, usually intravenously. Because the reality is that is just so much more common than cases of self-administration where, you would be prescribed a dose of lethal medication and take it yourself, which would be called assisted suicide in the technical sense. So someone asked, what if my client asked me to be an independent witness to their taking of that lethal medication? And the answer is, it's quite clear in the criminal code that you cannot be that witness. The law requires that witnesses must not be directly involved in providing health care services or personal care to that client. The other thing that could happen is that a client could maybe ask for help in self-administering that medication. And here the federal government has provided a little bit of guidance with respect to acceptable forms of assistance or help, saying a client may still need various forms of assistance depending on their state of health, and then they use the example, for instance, they may need someone to open the bottle that contains the medication or to lift a glass of water to their mouth. So clearly absent there is anything about emotional or psychosocial forms of help or assistance. So on these types of issues, or even being with a client at this stage without another health professional or a team with you, as far as I know, there is no social work guidance because I think it's just still so new and it is so rare. What I will say is that the guidance that the nurses have received, who we on this issue actually have a few parallels with in the sense that they are also not those two professions, they're not nurse practitioners, they're not one of those professions that can actually administer or determine eligibility. So the nurses have been told, if you've been asked to help a client self-administer a medication that has been prescribed to them for the purpose of MAiD, you should exercise extreme caution. And they leave it at that. You should exercise extreme caution. So with that said, this is new territory that, of course, has overlapping federal, criminal, provincial, regulatory concerns. So if a situation like this does arise, They're always so specific. There's always, individual issues with each issue. You really should consult with your regulatory body, a lawyer, your insurance provider, and of course, your employer. So to back out from the nitty-gritty, one of the things that I think resonated most for me, though, is this very simple but very profound quote, and it's from a friend of mine. She's a social worker in oncology. She works in a hospital, and we were just chatting informally, and she said, "It's really strange because everything is different, but nothing has changed." So to break that down further, MAiD is now a legal healthcare choice like any other, like the decision to not be resuscitated, like abortion. And social workers have always had complex, sometimes upsetting, and always careful and ethical conversations with their clients about end-of-life choices and care. And so in some ways, this is nothing new. So what have social work regulatory bodies actually said about this? So the stars here, they indicate regulatory bodies that have put out guidance on the issue. So you'll see that it is almost all of them, but not all. And you'll also notice that I put BC in orange because, interestingly, they published some guidance during that interim period before the legislation was introduced. But once the legislation was finalized, so that it is once the rules were clear and social workers were protected, they chose to remove it and then to not publish anything else. And ostensibly because, again, MAiD is now a legal healthcare choice, and normal standards of practice when addressing difficult or controversial topics would apply. So let's take a look at what specifically some of these bodies are offering as guidance. So I'm using Ontario's, so that is the Ontario College of Social Workers and Social Service Workers, just because it essentially summarizes the others. And if you look at all of them from across Canada, many of these guiding documents actually cite each other as references or for continued reading. So really this didn't take shape in a vacuum, and the reaction is pretty consistent across Canada. So I'll just read that. The law permitting MAiD is controversial and may arouse intense feelings and anxieties. Members are urged to ensure their competence, which includes gaining knowledge about the legislation, like what you are all doing on this call today, identifying their own values and attitudes to ensure they do not adversely affect clients, again, something that all of you already do on controversial issues, and seeking consultation when needed. As with all social work and social service work practice, the best interest of the client is the primary professional obligation. So let's take a look at another one. This one's from the Alberta College of Social Workers. Again, nearly identical to the other provinces at this time. And they have an FAQ section where they asked, what does a professional conversation about MAiD with a patient or a client look like? They say, while we do from time to time develop best practice guidelines in certain areas, the ACSW is not in a position to provide practice advice on MAiD at this time. Please consult with your employer regarding organizational practices. So this is a great example of what we're seeing across Canada, that healthcare organizations who are already experts in end-of-life care, they're really driving the finer details of practice to best fit the needs of their unique populations within, of course, the limits of the new law. So here is where I give my big disclaimer again. I'm not a lawyer, though I have chatted with a number of them on the issue. I'm also not a regulator. I'm not your regulatory body. The best thing to do if you're worried is to talk to your lawyer, your regulatory body, or a trusted colleague. This is also a perfect opportunity to maybe take advantage of the free legal advice that you do get if you're a part of our BMS liability insurance program. I'd also quickly add that most social workers are no strangers to needing to work creatively yet ethically within the confines of policies that they sometimes disagree with. Two, in terms of determining whether a client is eligible, while you may be on an interdisciplinary team dealing with this issue and you may be consulted, it's actually written into the criminal code that the nurse practitioner or physician must be the ones to determine eligibility. And of course, remember too that social workers are protected for anything that they do to assist in that regard. And of course, the final one on the right-hand side there, Just because it's legal doesn't mean that you're expected to be an expert. If you're working in geriatrics, for instance, no one would expect you to be an expert on, child protection or early childhood development or something. So I hope that alleviates some anxieties. The other thing I wanted to touch on is that it is really hard to give broad advice on this because care scenarios vary so hugely. It goes without saying, I think, that you would react very differently to a request to talk about MAiD if you're a private practitioner and say your client has ALS and wants more information than if you were, counseling an otherwise healthy adolescent that you were seeing for substance misuse. That said, the last item there in stars is refer. This one actually kind of surprised me in talking to lawyers. Their informal advice was refer. So when in doubt, get the client more information. There's no harm in linking a client to a phone number or address where they can learn more. And even if you think, or even if you're sure they aren't eligible under the fairly narrow criteria, it can be as simple as providing a hotline number. And as an aside, actually, almost every province at this time has a hotline number that provides more information specifically on MAiD. And I've linked all those provincial resources to our Medical Assistance in Dying resource hub on CSW's website. Or it can be as simple as telling them where to go in the community to get more information. So technically, social workers aren't allowed to independently assess eligibility, so this is just a good way to cover your bases and not put yourself at risk for a complaint. And then I would say after providing that information, that's where you use the skills you already have. You reframe and explore as you always would when someone brings up end-of-life discussions, or that may be using MAiD to indirectly sort of explore suicidal ideations. And as a caveat, some of the clinicians I've spoken to about this have commented that MAiD has actually opened up avenues for conversations about suicidal ideations. So it's actually been helpful rather than intrusive or worrisome for them. So what's next? What's next federally on this? We know we haven't seen the final version of this legislation. Advocates are still calling for better, more inclusive frameworks. Quebec actually is looking at allowing advance directives as we speak. So we know we aren't done with this issue. Both of these articles I have up here are from the past week alone, and so we know we haven't heard the end of this conversation. So what does that mean for CSW? So here at CSW, we try and we tend to frame our work around our mission, which is twofold. So first, it's to advance and promote the profession, of course, which includes supporting social workers in their work, and also to advance issues of social justice, so that advocacy piece. So the left column shows some future issues that our profession is likely going to be grappling with, and the right shows that open space, that potential for how we can support social workers moving forward. We do know already that we're going to be continuing to seek continuing education for social workers on this issue. And I'll just quickly mention on that note that we're hoping that at the end of this webinar, you will take a few moments to fill out the survey that will pop up on your screen. That's going to help us build future continuing education opportunities for you. But as you can see, the shape of these two columns sort of does remain to be seen. However, that's not to say that we don't have some indication from the federal government of what they are going to be addressing next. So they have publicly stated that they're going to be looking into additional research on requests by mature minors, advance requests, or they're sometimes also called advance directives, and also requests where mental illness is the sole underlying condition. And so, yeah, it was in December 2015 that the federal government announced that a review of these areas will be conducted by the Council of Canadian Academies. And for those of you that don't know the Council of Canadian Academies, it's a federally funded, independent, not-for-profit organization that undertakes evidence-based expert assessments to support and inform public policy development. They've also announced that final report of those reviews is going to be tabled in Parliament and available to the public by December 2018. And they have stated that the purpose is not to actually craft recommendations, but it will be rather to generate dialogue. So with that in mind, we do know that sometime in late 2018, or potentially even earlier, depending on how the government wants to structure this, we are going to be back around committee tables, in MP offices, at stakeholder meetings, giving the social work perspective on these highly charged and sensitive topics. One thing I wanted to do today, too, to fit into this presentation, was to give a brief case study on a question that causes social workers a lot of anxiety. This is something that we hear a lot. The ability to conscientiously object at this point extends to organizations as well. And so what we're hearing is that some of you are finding yourself in situations where you're working for an organization that doesn't offer MAiD, medical assistance in dying, and you're worried about what that means ethically for you, what that means ethically for your practice. So here I've chosen to just use a policy put out by Covenant Health. It's in Alberta. Not for any particular reason, just that it was a Catholic care organization that published their policies online and were easy to find. So you'll see here that it's pretty consistent with the ones put out by many other Catholic organizations. And it highlights their decision to not provide or explicitly refer for MAiD. So if you're a social worker in Alberta, working under similar policies, for an organization like this one or one with similar policies to this one, you're probably going to be thinking, okay, what does the Alberta College of Social Workers have to say about this? So this is taken from their guiding document, and I'll read that for you. Referral. Social workers who choose to not provide services around medical assistance in dying on the basis of conscientious objection must facilitate the referral of the client and family to another qualified provider. So you can see where some of the anxieties right there might arise. And you might be thinking, but I don't object, my workplace does. And here I think I would point out that some of the worry can be caused by the word refer. So refer can mean a very formal medical referral, which I think Covenant Health is here referring to. Or it can also mean something that social workers do all the time, which is to provide linkages to information and facilitate getting those other services and resources for the client. And then interestingly, when you look further down this same organization's policy, so on number 5, so this is another excerpt from Covenant Health, there, that number 5 at the bottom, you'll see that indeed the policy does cover the fact that they, of course, have a legal obligation to allow patients to exercise their rights and access a legal service elsewhere if they so choose. And I would just read the end there that says, either directly through HealthLink, which is that tool that I was talking about, the hotline that Alberta has, or by asking Covenant Health to contact AHS, the Alberta Health Services, at their request. So if asking someone to contact an outside service for you to facilitate that isn't a referral, then you are not referring. What I will say, again, is that social workers are usually experts in creative and ethically navigating organizational policies that, may not always fit with social work values. And that this, again, would be, if this arises for you, this would be another great time to seek counsel from your regulatory body, or, again, use that free legal advice, yes, I said free legal advice, that you have access to if you're part of the BMS CSW liability insurance program. And here, this is my last slide, and I decided that I would pair myths and FAQs because they really are essentially the same concern, just voiced either as a statement or a question. So one of the main things we get a lot is, I'm going to be forced to participate in MAiD. And again, I just want to highlight that the legislation is permissive. It means that you cannot be forced to do anything. And so if you conscientiously object, you do want to cover your bases in terms of your ethical responsibilities to your regulatory body and to your employer by providing information on how to get those services, but no, you will not be forced to participate in MAiD. This is another one that, we actually still get quite a bit, but we certainly got more of before it was legalized. People saying, this is a slippery slope, or is this going to be a slippery slope? So I can't, unilaterally answer that, but I can tell you what we do know already. And what we do know is that this is legal already in 4 European countries and also 4 American states. And so far, in those places, there is little to no evidence that medical assistance in dying has had any impact on the growth of palliative care, on the escalation of the number of requests for MAiD over time, so it hasn't grown, or disproportionate use by vulnerable populations. So some of those worries that were initially there haven't materialized in those places. The other thing, to use an example from Oregon, where assisted dying has been legal for almost a decade, in 2015, so in that calendar year, deaths through MAiD were only 0.4% of all deaths. So I'm just highlighting that to say that this is a rare choice. This is still a rare choice, and the use of this does not explode after legalization and implementation. So here's something that I think is a big misconception, is that people are saying this is completely new and different. Discussing MAiD is completely different than other discussions I've had with clients. Again, I would just say that this is now a legal health choice, and social workers know that your relationship with the client or the service user is always your most important tool, and we know how to talk about important and difficult and controversial topics. So again, just to reiterate what we've been hearing from a legal perspective, it is best to refer or to provide more information always, and that's really the only new or extra piece of information that you're going to absolutely need. Here is one too. People are concerned or worried, or they would phrase it, if a client asks me, am I eligible for MAiD, and I know they aren't, because they aren't near the end of life, their death is not reasonably foreseeable, or they don't have a physical ailment, do I have to tell them that, or how do I tell them that? And that is not your responsibility. So just to say again what we've heard from lawyers, that in the criminal code, social workers are not actually legally allowed to determine that eligibility. So you can certainly voice what you are aware of. From my perspective, this is what I know about this information. Here's where I can get you more information that you can explore by yourself. Here's a linkage I can make for you. Here's another one we get. I have no expertise in end-of-life care. If a client brings this up, I have nothing to offer. And we hear a lot of anxieties like that. And I would just say you certainly have something to offer. You can explore and normalize the underlying motivation behind the request in the same way that you would with any other end-of-life discussion or any time that suicidal ideation comes up in your practice. And finally, this is one we get a lot too. The word MAiD has negative connotations. Can we change it to something different, to something that sounds more empowering or better? People really don't like the word MAiD, and I get it. Can we change it to something that expresses the fact that a person is taking charge of their own care? And unfortunately or fortunately, the answer is no. We do have to call it MAiD because that is the legal term in the criminal code and in Bill C-14, so we are stuck calling it MAiD. So with that, I would just say thank you again to everybody for taking time out of your day to tune into this and to learn a little bit more about CSW and about our advocacy efforts and about this new legislation from our perspective, and I certainly look forward to taking any questions that you have.
Thank you very much, Sally. This is Jan back again. For those of you who are interested in the topic, there are social work teams out there practicing in this area. If you look at the CASW website for the list of social workers who received awards, the CASW award this year, nominated by their provincial association, Manitoba's was a social work team who worked with a team of nurses and palliative care physicians to provide medical assistance in dying. Some of the questions that we're seeing that I've got on my screen are some of the ones that they answered for us, and I'm going to forward these one at a time to Sally and let her give her answer to them too. So the first one is, when will there be concrete training in this area?
So that is a question that certainly we can hold ourselves account to, but is going to be really something that develops probably at the provincial level. So one of the other questions that's related to this that we get a lot is, how can I help? How can I participate? How can I influence this? And one of the things you can do is to get involved with your provincial college or association, so your provincial regulatory body or association, and tell them that this is what you want. The thing about CSW offering concrete sort of like practice tips is that we are of course federal, and while the criminal code is federal, so some of these changes legalizing this and sort of at the higher, broader level came across at the federal level, it is still drilled down province by province. So there are still going to be provincial differences. For instance, in some provinces, nurse practitioners can determine eligibility and prescribe the medication, and in some provinces, not. In some provinces, social workers are legislated as a healthcare professional, and in some provinces, they are not understood in that way in the legal sense. So in order to really have that hands-on practical training, it is probably going to happen at the provincial level. Not to put a burden on the partner organizations, but that is probably where it's going to have to arise. And like I mentioned too earlier, major healthcare organizations are sort of taking the lead. So organizationally driven policies are arising. And I was going to mention this at the end, but I'll just throw it in right now. For instance, if you go, so most major hospitals have sort of portals on this, and one that I would mention, and I would just as a caveat say, we don't endorse the University Health Network in Toronto, and we're not affiliated to them in any way. But if you Google University Health Network, so UHN, and MAiD, Medical Assistance in Dying, you will find their portal. And I also have linked to their portal on our website, on CSW's website, under the Medical Assistance in Dying Resource Hub, that if you go on our main menu and you hover over resources, it'll drop down to that. So I have linked to this resource I'm referring to now there. And what they've done is they don't have modules of training for social workers or anything, but they do have video vignettes that you can watch that elaborate on some interesting situations that could arise and how those conversations take place. So if you want to watch those are available. It is the Ontario perspective, but it is also broad enough that it would probably be applicable to most people. The other thing that's on there on that portal is they actually have posted some of their algorithms, so that being the actual process that a patient and their care providers, so their care team would go through to determine eligibility. It's sort of like a matrix, and that's posted so you can see, well, a sample of how this takes place on the ground. So summarize, I would say that, we don't have any plans at this point for concrete training, especially knowing that the final version of this legislation hasn't actually been tabled yet, and we're still waiting for that, and that likely the resources you want to look to at this very moment would be by looking around at major hospitals or healthcare organizations in your region, and then by looking to your provincial organizations for their guidance.
Thank you, Sally. There is another question, similar but but different enough that I think it needs to be addressed on its own. We've got a request. Please clarify where we can find the link to MAiD hotline. You mentioned, I think, hotline.
Okay, yeah. So I'm going to go on the computer now so I can say it to you exactly. So if you head to our homepage, CSW-acts.ca, that main bar above the Power to Empower banner right now, the second link from the right side is resources. And if you drop down, the fourth one down is Medical Assistance in Dying Resource Hub. And if you're not on your computer right now, so you're not following along with me, that's totally fine. The other thing you can do is just head to our website, and there's a search function, and just type in Medical Assistance in Dying, or MAiD, and that resource hub will be one of the links. And so there I've posted some national resources. So it goes over the legislation. You can watch the video of our our witnessing at the committee. You can read our discussion paper. You can read our statement of principles, a bunch of other things too. I've also linked bioethics centers there, and then of course those provincial social work resources. So you can click on those, and then at the very bottom, provincial government resources. So that will link you to a list of all the provinces and all the drop-down information for what you're looking for. So that's all there.
Thank you. The next question is, can CASW help address the barriers put forward by the Canadian Society of Palliative Care Physicians, as their president, Dr. McDonald, has stated, and there's quote, physician-assisted suicide should happen separate from palliative care, absolutely, end quote. And I would just add that this was covered when we had the MAiD social work team honored in Manitoba. They did say that, that some hospitals said that they needed to move the location for medical assistance in dying away from the unit and into a separate area. So having said that, Sally, what can we do to address barriers? What can we as social workers do? And I guess part of this is, how can we become part of teams?
Right. So yeah, this is also one of the concerns that comes up with the Catholic Care Organization question as well, which is that integration of care and the fact that, many advocates feel that a patient or a client should absolutely be able to receive the care that they are legally entitled to wherever they choose to get care. Right now, like I said, organizations, so healthcare organizations like hospitals, are actually able to conscientiously object, so they can decide how to either not at all offer it or to offer it, like you're saying, in a different location. We at CSW right now, we don't have consensus stances on any of these sort of finer details. First of all, because it's still so new, and second of all, because it is going to be so various and different in the different provinces and even in different municipalities. So what I would say is that one of the greatest tools for advocacy, for saying things like, we should not be unduly moving vulnerable people or, causing them more suffering and trauma by needing to move them near the end of life when they should just be receiving, a continuum of comprehensive care. One of the best resources for that is the Code of Ethics, to say things like, putting the client at the center of their own care. We shouldn't be squabbling over location. We should be putting the client at the center and making sure that they are the priority and that their wishes are the priority within, of course, the scope of the law. So I know that didn't give a fulsome answer on what CSW can do, because we haven't developed a national stance on that yet, or we may not. But know that, you are always armed with the Code of Ethics and with, the guidance by your regulatory bodies to make advocacy moves like that.
Thank you. And I think We also know that CASW works with the Canadian Medical Association on other projects, so there's possibility.
Yeah, we do have a good relationship with them, and we do too have a pretty good relationship with the Canadian College of Family Physicians. So yeah, as this issue moves forward, so as it becomes more sort of ingrained in our society and as organizational policies start to sort of firm up, that's when CSW is going to be able to, in partnership with some of our colleagues like the CMA, see where these sort of broad issues are arising, because it really is our policy not to comment on direct sort of like practices by an individual province or hospital, but if something was arising like this that we could comment on in a broad strokes federal way, then that would be certainly something that we could address.
Thank you. And I have one actually that I think has been one that we've been asked in the past. You've mentioned accessing legal advice. Can social workers access free legal advice?
Yeah. So we get this question a lot. As soon as I say the free legal advice thing, people are like, wait, what did I miss? And if you have our liability insurance program, so if you're part of the BMS liability insurance program, part of that, other than just being covered in the event of a claim or a complaint, for your legal fees and everything, the other thing that you have access to as part of that is free legal advice. So Gowlings WLG, that is the law firm that does this for us. So if you're a member of the BMS program and you are concerned about something's not sitting right for you, you just want to bounce some ideas off a lawyer, and it's all private and everything. If that's something that you want to do, you just call and give your number, and they will talk to you. So if you want to learn more about that program, if you go to our website under member benefits, you just click on BMS liability insurance, or just go to our website and use the search function for liability insurance or for BMS. It's an absolutely amazing service, and I would encourage you to use it if you haven't already.
Thank you. And another question that's, I think, still related to one that you've answered earlier, but I will bring it up separately. So with the points made earlier, the caller has said, how do we, as social workers, work to expand accessibility of medical assistance in dying going forward? And echoing your comment, the social worker has said, many countries have successfully integrated MAiD into healthcare and palliative practice so that groups not yet included here are covered. And I think the youth is one of the areas that this caller has said. I guess from what you were describing as mature minors, it sounds like they may be given service in other countries. So how can we? Yeah.
So the question being really, what can they do to improve access? I'm getting that right?
Mm-hmm.
Yeah.
Yep.
So I sort of mentioned this before, but I mention it again. So I think there's sometimes a misconception with CSW when you just see me or one of my colleagues here at the national office presenting on the national level that maybe that's my opinion, and that's absolutely not the case. So the way that we go about our advocacy efforts on the federal level is that there are many, many steps. It is a consensus decision model, and that we are always taking our input and our direction from our board, who are comprised of social workers that are taking their direction from their partner organizations. So if you want to have a voice with us, pester your board member, pester your provincial association or your provincial regulatory body, or also always you can contact us directly. So we can have our finger on the pulse of what frontline social workers are wanting and needing. The other thing I will say, and that's just in terms of specific policy positions or options. The other thing I hope this alleviates some worry, the fact that because we know that the government is actually currently doing a review of those issues I mentioned, so advanced directives, access for mature minors or youth, and what was the other one? forget what the other one was, but they're looking at a host of different options for people. I would just say that make sure that you are keeping, your view on CSW and what we're doing, and that you're keeping in touch with your provincial regulatory body to see how provincial policies are evolving, and that we will certainly be contributing to those talks. I can't yet say what our opinion or our position is going to be on that, because once again, I don't get to make those decisions, and Jan, you don't even get to make those decisions. That's going to be as a result of some really deep social work ethic and values soul searching, I think, and really important conversations with our partner organizations and our board.
And I have actually one more question for you, Sally, and then I am going to have to close off. Interesting. Actually, two more questions. The first one is, please explain mature minors.
Yeah, so it's not actually very well elucidated, I would say, in the criminal code. One of the interesting things about issues like this one that happen at the intersection of criminal, so lawyer speak, like the criminal code, and healthcare, is that we are very used to, in the health and social services sectors, we have very rigorous definitions of things. So, I'm not even an expert on that, but talking to people that are experts in, for instance, early childhood development or in child protection that know all the stages of development and all that kind of stuff, we are used to having very well-defined categories for these things. So what the criminal code says, because once again, it is a legal document developed by lawyers and other stakeholders in that field, in that sector, it actually just says mature minors. So we have heard different sort of ad hoc definitions of that from politicians and from bureaucrats, sort of speaking in interviews and things like that, and some of the provinces have begun to try to decide what that would be. And very broadly speaking, it might be somebody over 16. It might be that simple, or it might be that a province will develop a tool to determine maturity, which I don't even know what that would look like. But that's to say that there is no one answer. But broadly speaking, it would mean youth, like not children.
Mm-hmm. And the last question, it's actually directed to you personally, Sally. And it's would an MSW /JD, so I'm assuming that's the law degree, help me get into work like yours? So I'm maybe you could address that from both your hats, the policy director hat and the committee member looking at this issue.
Yes, I mean, absolutely. That would be probably the perfect, probably more qualified than me to do this. And, CSW, we do get people, when we are active on big, important issues like this, we do get people asking, do you have are there any job openings at CSW? And I will say that we are a really, really small national office, so no, not right now. But there are lots of amazing nonprofits, NGOs, other groups like that we partner with and that we are on coalitions with that are doing similar work to this, that would find a combo of MSW JD, like one of those degrees. There's a few universities that are actually offering those in conjunction as like a one program, which I think is amazing. That would just be over the moon for a new hire with that combination. What I've seen in my work on national coalitions is that social work degrees, I think it probably goes without saying that law degrees are respected, but something that probably shouldn't have surprised me, but honestly did, was that in those rooms, a social work perspective and a social work degree is actually incredibly respected. They know that we have expertise in person and environment and systems, and that we're experts in social justice and in advocacy and then putting people first and using self-determination. So especially for this type of work, absolutely you would be a candidate with that combination. But just generally in any advocacy area, MSW JD can't go wrong.
That's true. Manitoba's Deputy Children's Advocate is a lawyer who is also a registered social worker. So
there you go.
There you go. There's a whole area of career opportunity, as you say, when you put those two respected professions together. I want to thank everyone who's tuned in for attending today to learn more about CASW's advocacy efforts. And again, I apologize if we weren't able to get to your question, although, okay. Someone has just sent in a last comment, which I'll read, and then I think we will have to shut down. As a macro social worker, thank you for making the point. I get the same reaction in meetings and summits. Oh, and someone has sent in a thank you to you, Sally. So
well, that's absolutely
again,
that's
Sally.
great to hear. I can certainly attest to that. The huge respect that that the movers and shakers and policymakers have for social workers. So yeah.
Yeah. So as a reminder, the PowerPoint and the recording will be on the CASW website shortly. If you've attended 45 minutes of this presentation, you can get confirmation of attendance for continuing education. You can get it from downloading, it can be downloaded by clicking the yellow icon rightmost at the bottom of the presentation window you're watching now. A few hours after the conclusion of the presentation, you log back in using the link you're using now and then click that yellow icon to ensure that you will get your confirmation of attendance. Thank you in advance for taking a few minutes to complete our survey to help inform future continuing education opportunities. Until next time, thank you all again, and enjoy the rest of National Social Work Month. Thank you so much. Oh, more thank yous for you, Sally.
Thanks, everyone.
Goodbye.